Oh, yay. It worked. That's like the first thing that actually went right today as far as electronics. Can everyone hear me?
Yes.
Okay. I feel like the day just started all over. All right. So we'll get started. There's only 21 on. I know that some people have clinical and some doctor's appointments and stuff. So and you guys all have a lot to get done. So I wanted to just do the quick housekeeping, which is I'm not sure if you saw the announcement, but I want to make it very, very clear. It's not that I don't want to talk to any of you or spend the time on the phone with you, but these calls usually can take anywhere from 30 minutes to an hour. So I had done a couple of this semester's and then I did all of the other semester. And when I was having a conversation with one of the instructors, they said, why are you don't, what are you doing? No, you don't have, what are you doing? And I guess we just needed to do office hours. I'm more than happy to meet with anybody. But 27 meetings, that's 27 hours. Because, once I get you on the phone, you're going to be with me for a long time. So please don't hesitate. If you need anything or you want to talk about something or you're struggling with something, don't feel like you're bothering me. You're not. I think I've made that very, very clear, and I hope that you take advantage of that if you need it or any support. So that's number one. The only other thing that I wanted to say before we get started is that from what I can tell, and I'm going to be doing a lot of grading today, actually this week in general, I pretty much took off and I have some stuff, how would you say, not personal, but kind of some family stuff going on right now. So I'll be home, which is good. So I'll get a lot of grading done and I'll be able to kind of catch up, and probably how you all feel at times. So you can hopefully look forward to some feedback. And then I wanted to let you know that I also really am paying attention to what you're saying as far as what you're hoping to get out of the class. Third semester, we basically built our class. So we know what we're going to be doing on our class. And I feel like thus far, we've been able to do that now that I asked that question with the assignment. And from a lot of you, I don't know if you knew this or if I did put, eventually I was going to put it into an announcement, but a lot of people are saying the same things, study skills, do stuff for NCLEX, medications, things like that. So, and then of course, if there's anything that you learn in class that you felt, you were struggling with, please text me and let me know. Please say, Miss Amanda, today we went over this and it was really confusing, because more than likely, if you thought it was confusing, at least half of you might be in that same boat. Doesn't mean we'll spend the whole time on it, but we can at least go over it. Okay? I just wanted to make sure to get that out there, because I know your first semester and probably having more work than you can even imagine. You all look exhausted. That's not that, how people say don't say that, because that means you look like, no, it doesn't mean you look bad, but you all look, you can just see it in your little eyes that everybody looks like, help, save me. Okay, so let's go ahead, and before we get started, does anyone have any questions? No? Okay. I hate that I can't have my face up right now. I'm so sorry. It lacks the energy, I feel. So I do apologize. My dog completely did ruin my computer, and my whole thing is peed on. So I now it's just awful. So I'm buying a new computer, hopefully next weekend, because they're so cheap. And then we'll be in a better position. Okay. So what we're going to do today is kind of what I said earlier, which is kind of an introduction to certain things that we're going to be doing. So every time we meet, I do want to do one or two NCLEX style questions. I really like that. If I recall, we did a couple last week. Was that, no, we did. Yeah, we did. Yeah. You guys actually did very, very well.
Yeah, we did.
Yes, thank you. I'm like, wait a minute, because I just met with the other guys yesterday, and I'm like, who did I do this with? And your explanations were just very impressive. And I don't mean it demeaning when I say especially for semester one. I mean that as a compliment. Being semester one and being able to answer the questions the way you're answering them is it's amazing. And if you're not there yet, it's still okay. That's why you're here, right? So that we can get you there. Okay, so we're gonna do, I believe it's 2 questions together. And then we're going to do, basically I'm gonna introduce you to my medication madness is what I call it. We're only doing 2, same thing, 2 medications. And it's basically gonna be my way of showing you the method on how I teach students on a way to help remember medications. And because in my opinion, and the opinion of at least several students and classes that I've taught, the method tends to help them. So I'm hoping that it helps you. And it's about making connections. You'll see what I mean when we get to that point. And also, if you have to go during this discussion, something happens or you need to do something, please remember this is being recorded. So you can always, I'm going to download it and then put it in the box for today that says the date. I mean, I want you to hopefully be here because I want you to participate. But if something happens, but say goodbye, please. And then you don't have to, but please say goodbye. And then you can hopefully watch the recording and do the assignment after. Did you have a question? Anyone? No, I just see a beautiful face. Okay. All right. So I'm going to share my screen with you guys. And it should be here already. Hartnell. Okay. Perfect. Can you guys see right now, like the Zoom meeting?
Yes.
Perfect. Thank you. Okay. And should be in your class. You guys are 226. Yes, you are. I've got that down now. 226. And we are on the 23rd. Okay, so this is done. Then you have this small assignment. I'm not sure if you guys, oh, it doesn't open, I don't think, until after class. But let's look at it. Oh yeah, yay. Okay, so that's what I wanted to say, sorry. And I spelled class. Oh, wow, is that about word? Yep, I did. So that was the typo right here, yay. So I know that you guys did nursing process last week. I talked with, is that Nancy? Yeah. And so she wanted me to focus on that. However, I don't think we need to spend an hour talking about nursing process and then do this whole thing on it because you did it. So what I did was the NCLEX questions that I picked are about nursing process. So at least one of them is. And then this assignment here just asks a question just to kind of reiterate it basically. So we're trying to give me the autonomy to do what I feel it is needed rather than, again, more busy work, and make it not take over your life so that you can, not have this. I don't want this class to add stress. I want it to take stress away and say, wow, okay, cool. All right, I'm feeling better about test taking or whatever we're doing. So, and I'm sorry if I'm repeating myself. Because I'm teaching 3 very similar classes. So I'm not having any sort of brain issue. It's just, I get lost. All right, so we're gonna go ahead and start with the NCLEX questions. We're gonna do 2 of them. One is it's probably one of my favorite questions because it is about nursing process and it's so important. And it has so much to do with the fact of what we talked about last time. Do you remember last time, one of the tips I gave you, we're actually gonna do this one first, the nursing process question. Do you remember how I told you, of course, looking at age can be important, what site, if they had something done. And then a lot of the time when they ask what is most important or what would you do first, you're usually gonna do, you're usually gonna do all these things, right? Or actually, wait. Oh no, it's a wrong question. Oh my God, I put the wrong Amanda. I'm funny. So this is the right question, but this is not the question that I wanted. So what I'm gonna do, I'll just make it go away and it's fine. And I can actually just like regurgitate the question because I know it so well. done via Zoom out loud. In case anyone's watching me. Sorry, guys. Being human is hard. Okay. So this is even harder, actually, and will hopefully help with the critical thinking aspect, because I'm going to actually just say a question from memory because, again, I've done it so many times. So let's go ahead and rethink about what I said. Usually, if it's priority or what do I do first, a lot of the time you will do all 4 things. So you have to figure out, what am I going to do first? And that would be a nursing process question, right? Usually it is, and you'll see why in this question. So I'm going to just basically regurgitate the question. So we have a child. There's no age given on the question when it's actually written out. So we have a child who just, so they don't give an exact time, but they say just had a tonsillectomy and is continuously swallowing. What should the nurse do first? Number 1, check the throat. Number 2, take the blood pressure. Number 3, call the doctor. I can't remember what number 4 is, but those 3 are good enough for the point that I'm trying to make. So we know we have a child, and that doesn't necessarily matter, other than the fact that they may not be able to articulate as well. And what do we think is happening to this child? So where are tonsils? Near our neck area, right? And the child is swallowing continuously. What do you think might be going on?
He has an itchy throat.
Bleeding.
Potentially. See, this is what I love about it, because we don't know, right? I love that you said that. Potentially itchy throat. Could the child have swallowed a cotton ball? Could they be choking? Oh, the one other thing they mentioned is agitated and restless. So that's something in the question that they say that this child is acting agitated and restless. I want you to write down, most of the time when you see those 2 words, this is so helpful. Normally it means that they're having trouble breathing, agitated and restless. Not always, but usually. And if you actually look at that whole question, tonsillectomy, that's near your airway, right? They're continuously swallowing. They just had their tonsils taken out. They're agitated and restless. And then potentially what could be going on? 50 things could be going on. How am I going to know what's going on? So we have to think of nursing process, right? And most people actually take the blood pressure. And I can see why. So we're going to do all 3 things, right? Of course, we're going to look in the throat. We're going to take the blood pressure. And more than likely, we're going to end up calling the physician for something, more than likely. Because, why? What do we think is happening?
He has an obstruction.
Possibly a clot. Yeah, or an obstruction.
And what do you think the clot is made of?
Blood.
Exactly. So more than likely, this little guy is bleeding from his tonsillectomy. So he's having trouble breathing, and he's continuously swallowing because there's blood continuously in his throat. So most people want to go to blood pressure first, because can anyone tell me why they would want to go to blood pressure first and say, oh, that must be the right answer? Let's see. Why would we think that? And I can see why. What happens when you're bleeding a lot? What can potentially happen if you're losing blood?
Low blood pressure.
Exactly. Your blood pressure can drop. So, did I spell question wrong? No, I didn't. Okay. So that seems to be one, and that's a great question. But now or great answer, but let's pretend, and then other people will say, call the doctor. Okay, so let's say we call the doctor. So ring, ring, ring. Hi, this is Dr. Kite. How can I help you? And they say, I've got this, I'm just making this up, 5-year-old post tonsillectomy, is continuously swallowing this, that, the other, and I explain the whole situation. What do you think the doctor's going to ask me?
Have you looked at him yet?
Yeah, where would you look? Where was the surgery?
In his throat.
Exactly. So perfect. So think about nursing process. What are you going to do first? What is the first step in nursing process?
Assess.
Exactly. So if I called the doctor and I mean, it happens, we're all, you know, we have to start somewhere, right? And it does, it happens. It becomes second nature. Eventually you just, I don't know how it happens. It's this magic thing that happens to us, and we just become, you just know what to do. Practice makes perfect, right? Or not perfect, but there's no such thing, but close, very, very close. So that's going to be the first thing. What does the throat look like? Because we don't really know. More than likely, yes, the child is probably bleeding. And that is actually what the notes say when I get this NCLEX question. But again, I don't know. Maybe what if they're choking? What if they have cotton balls next to the bed? Or what if the child put something in their mouth? Or who knows what's going on? Maybe nothing's wrong. But I need to look at that throat. That's going to be the first thing. And that's why I asked that question, because it has to do with nursing process. Now, in the real world, more than likely, we'd have more than one nurse in there, right? But we can't make stuff up. But in the real world, I'd be having someone, the little guy would probably already have a cuff on. I'd press the button as I'm looking, and it would be this we could do everything and have the doctor on the phone within like 2 minutes. But if we can only do one thing, because we can't, this is not a multiple choice. So what is the one thing that we would need to do before we could do anything else? We would assess. So we would look at the throat. Does anyone have any questions? I'm sorry, you can't actually see the question, but does anyone have any questions about the agitation, restless, just had a tonsillectomy, continuously swallowing? You will always want to look at that site. It's very easy. Open your mouth. Hopefully. And then hopefully they don't fight you, because you might get bit. It has happened. And then you can see, oh, okay, I see bleeding. All right, let's get that blood pressure. I want to know what it is. That way I can report it to the physician when I call. Is there anybody that would not argue? What's it called? Not debate. Disagree. Or does it make sense to why we would do this?
Yes.
Okay. Perfect. Awesome. Okay. So that's my nursing process question. Yay. I did my duty for what you guys did last week. And now we're going to do the top one. So I picked this one specifically because I'm kind of assuming that most of you have not seen a CVAD, aren't really familiar with it. And that's not the point. That's why actually I chose it, because I'm not going to even teach you what a CVAD is. I do want you to look it up when we're done, but I'm purposefully not telling you what it is, because I want you to look at a question when you don't know what something is and see if you can still get it right. Because that's going to happen on the NCLEX. You're going to get questions and you're going to say, oh my God, I don't remember what this is or that is, but you don't always have to know. Let me just put it this way. And I'm not saying you shouldn't study or, obviously go prepared, but the person who taught me was not a nurse. When I learned the Kaplan and how to do the NCLEX stuff, half of my training was not a nurse. And he passed the NCLEX. Again, I'm not saying that you don't need nursing school. I don't think he'd be good on the floor, but he had a way to be able to know how to answer questions. I just want to put that out there. Okay. And I know that you guys are going to get it once we go through this question. So the nurse cares for a client receiving, I say PN because I have trouble saying that word, pronouncing that word, PN through a central venous access device, which we call a CVAD. It's basically a type of IV. Think of it that way. I will give you that much. Because I think you'd be able to figure that out if you didn't know what it was, which is the most important action for the nurse to take. So it's not saying, what do I do first? It's just basically asking me, what do I need to do to this CVAD? What would be important? And so I need to be looking for something right or something wrong. That was a question.
Something right.
Yes, something right. So we're looking for something right. So with this CVAD, okay, so let's just pretend I don't know what this is. Number one, Remove the old dressing over the insertion site, moving against the direction the catheter is inserted. I'm going to read them all. Number 2, clean the insertion site with an alcohol swab, moving from the outside to the inside in a circular pattern. Number 3, flush the unused catheter lumen with a 10 ml syringe. Or number 4, use clean gloves to reapply an occlusive dressing to the insertion site. So right off the bat, can somebody be brave? Someone who hasn't answered a question yet, and tell me what can we immediately get rid of just by reading it?
Number 2.
Exactly. Was that Christian?
Yes.
And can you tell me why?
Because, well, like, think about it when you're giving injections. You want to go from inside to outside.
Inside to outside. Exactly. Because we always want to go, we don't want to infect, right? So we don't want to go from from clean.
From clean to dirty.
Exactly. So, and that's for pretty much anything. And so that's stuck in our head. So that is exactly right. So I know immediately, again, even if I don't know what this is, I know that's wrong. And the whole point of doing this is to hopefully get down to the least amount of questions possible so that we have a better chance of getting it right. So yay, perfect. Great job. So let's get rid of number 2. It is gone. Are there any other ones that look a little bit potentially odd? And if you don't know, that's totally fine. Because I'll tell you. So I'm going to give you one more hint. The CVAD is a sterile procedure. Because you see there how it says venous access device? And when you look this up, you'll see where it goes. So
Number 1.
Which other one could we get rid of?
Number 1.
We could get rid of number 1, but that one actually we can get rid of for a different reason. And what would that reason be? And anyone's welcome to answer it. What is the last after the comma? What does it say?
Move against the direction the catheter is inserted.
So if I was taking out something out of your body or cleaning it, do I want to bend it? Especially think if you're taking like an IV out of somebody's hand. Am I going to, and let's say I'm standing in front of you. Let's say I'm with Guadalupe. And she has an IV in her hand and I'm standing in front of her. And let's say I'm going to be taking out that IV or cleaning it. I'm going to be doing it towards me, right? Not bending it back. Because what could potentially happen?
You can pull it out.
Exactly. You could pull it out. You could dislodge it, which is the same thing. Or you could potentially, what if a piece breaks off or anything in the opposite direction of something that's inserted in the body, we want to, that's a red flag. So remove the old dressing over the insertion site, moving against the direction the catheter is inserted. So the key there is, and it can be just one word, against, and then I see catheter, and that doesn't look right to me. So I can get rid of that one. And then I said this was a sterile procedure. So can somebody, sorry, I can't see everybody. So I'm just going to pick. Laura, can you read number 4?
Use clean gloves to reapply on exclusive dressing to insert site.
Exactly. Thank you so much. So using clean gloves to reapply the occlusive dressing to the insertion site. Would that be right if this is a sterile procedure?
Yes.
If it's a sterile procedure, would you use clean gloves or sterile gloves?
Sterile gloves.
Sterile.
Sterile gloves?
Exactly. So they're trying to trick you. Don't let them trick you. They're mean. They will. And they will. It's because number 3 looks stupid, right? Like, oh, how could that be the answer? Just flush it. And that's the answer. And this is, again, one reason why I picked this one, because it's like, really? Like, that doesn't seem right. But it is. So there's several reasons why I picked this one. Number 1, I was hoping to pick one that you might not be as familiar with. because I wanted you to kind of see that you can answer the question some of the time without knowing exactly what it is, just by your prior knowledge. And you guys, you just started nursing school, and look, it's still at like all the information you knew. That's pretty, I mean, amazing, right? I mean, I don't know, maybe it's just me. But Hartnell does a really good job, so I'm impressed. And then I also wanted to show you, it could be the answer that you're like, I mean, okay, but it's not wrong, right? Flush the onion catheter with a 10 ml syringe. There's nothing wrong in doing that. It's not mentioning, it's very simple. And even if I don't like the answer, I can fight why every other answer is wrong, because I know it's a sterile procedure, so it can't be number 4. So if you use clean gloves, I could potentially give you an infection in your heart. You'll know that if you look up a CVAD. I'm kind of trying to entice you to want to know what it is. Number 2, we know isn't right because of infection control. Same thing. And then we know number 1 can't be right because we would never go against the direction of a catheter that is placed in somebody's any venous area in your body, because that would be completely dangerous. So even though I don't really like this answer, this is the only one that isn't gonna harm my patient. So even though it might feel a little bit yucky, it's still the answer. Are there any questions about that? And if you feel kind of like a little bit confused, that's okay. When you look up what a CVAD is and actually see it on the patient, and it's located usually up near their collarbone. But are there any questions how we got there? And even though we know that kind of sounds a little silly, the other ones are wrong. So we have no choice but to pick number 3, because there's nothing wrong with that. We can flush.
Wait, Miss Kite, is flush and priming the same thing?
Ooh, is it? You guys tell me. Good question. Is flushing and priming the same thing? What is priming?
Is unused catheter removing? Is that priming it? I'm trying to understand it, that's why.
No. It's a good question, and I'm asking our classmates.
No.
And why not?
Because you're priming the line to be used, and then you're flushing it to clear it.
Exactly.
Oh, that's why.
Exactly. So and the hard thing is too, is that sometimes nurses will use words interchangeably. So it wouldn't be wrong. How about this? I think this might help. If it said to prime it, it wouldn't be wrong. Number 3 would still be the right answer. Does that help at all?
Yeah.
And is syringe spelled right? What is going on with me? I feel like nothing. Do you ever have that day when you're reading and you're like, nothing looks like it's spelled correctly? Yeah, that's how you, okay, yeah. I'm having one of those weird days where my brain is like not connecting to my, I was gonna say my heart, but that doesn't connect to your heart now, does it? Does it, nurses?
Yes, it's right.
Oh, only if you're in love, which I'm not, so, okay. With my doggies. Okay. So, I mean, it's helpful. I know it's frustrating. And again, I didn't like write the questions myself, and it's not always, going to be perfect, but that's why we do this, because we're going to keep doing this week after week after week after week. And again, it's 2 questions, and we're almost done. It's 1:37. We'll be done. And I'm not that I don't want to, I could be on here for 3 hours with you guys, but I'm not going to do that to you because you have other things to do. So, okay. So the last thing that I want to do with you, please, is, so I'm going to stop this share, and we're going to do, and there's only 2 on here, so don't worry when you see it. Oh, don't look at that. That's private. Okay. So I'm going to do 2 medications, and I chose 2 on purpose. So I want to start with one that is what I call basic, and then what the next one I call more complex, as far as, and we're going to be doing this every week. So every week, and it'll get a little faster and a little faster each time. This is introduction. So this is, a lot of people wrote down that they're interested in, how do I learn medications and medication? I mean, medications are hard, right? What kind of medications are you guys going over right now? Or have you started that yet in farm? Or are you in farm?
Not yet.
Not yet? Okay, even better. Perfect. Okay, so I purposely picked 2 medications that were pretty familiar. I'm pretty sure everyone's heard of Tylenol. If you haven't, now you will, but I'm pretty sure everyone's heard of Tylenol. It's an over-the-counter medication. So does Tylenol require a prescription? If it's just Tylenol?
No.
Exactly, perfect. And so this is how I would normally do it. And I wish you could see me because I have hand gestures I use. It's so weird, but I swear it helps you remember it better. So next time you'll see what I'm doing, and then you'll start doing it, and then just watch. It's very interesting. By the end of the semester, you guys are going to have like 50 of these, and you're going to know them all, and you're just going to trip out. And everyone always looks at me like I have 18 heads when I say that, but just watch. It's magical. Okay. So my simple one here is Tylenol. And I say simple because I'm going to ask less questions about it, but it's still important, and I'm going to make connections. So what is the other name for Tylenol? So Tylenol is the brand name. What is the
Acetaminophen.
Acetaminophen.
Acetaminophen? Absolutely. Very good. So that would be considered the generic name. And
I think you have them.
I'm sorry?
Sorry, I unmuted myself.
Oh, no, you're okay. I was like, is someone yelling at me? What's happening? No worries. We all do it. Okay, so we have Tylenol, and the other name, I just usually say, what's the other name for it? Acetaminophen. Very, very good. That would be important to know, I think, especially for the NCLEX, because the NCLEX usually will always use not the brand name, they use the generic name. So, of course they would, because why not just use both? Sometimes they will, sometimes they won't, but usually it's generic. Okay, so that's the first question. Now, my second question is, what is the classification of Tylenol? And what I mean by that is, by classification, it has 2. So I'm going to give you the first one, and it's an antipyretic. Do you guys know what antipyretic means?
For fever.
Exactly. So it can help lower a fever. So the classification of Tylenol, it has 2, would be antipyretic, as well as, and this usually trips people up because it's too easy. So you think it's like this big hard thing. What is the next?
Pain reliever.
Yeah.
Analgesic. Anti-inflammatory as well.
Ooh, okay. Oh. I almost was gonna do this to you guys, but I will make that part short. So I heard anti-pain, I believe, and anti-analgesic, so that is come here, my dog is like trying to step all over the thing. Don't do that. You're gonna log me off. Okay. So Tylenol. The other name for it is what?
Acetaminophen.
And what are the 2 classifications? The first one is what?
Antipyretics.
Antipyretic.
Antipyretic and anti-pain or analgesic.
Analgesic,
Yeah.
something
Yes.
like that.
So by the end of this, what I'm hoping is that we're all like, literally, it's kind of like this squad that is like in the like military, that everyone, it's really cool actually to do, and we can even do it this way. I've done it via Zoom. It's more fun in person. Okay, so we'll talk about so basically, just real quick, NSAIDs, that would be anti-inflammatory. So Tylenol actually, and a lot of people, tons of people, even my 3rd semester students will get them mixed up. So it's really important to understand, and this is why we make the connections. Because why would we make that connection? Because we want to know why someone's taking something. So if somebody has inflammation, so some people have a headache because they have inflammation. I get headaches because you guys probably all get headaches because your head's always down because you're typing and studying, and you're stressed, so your muscles are all tight. So for most, not always, but an anti-inflammatory might help really, really well with that because it helps to reduce that inflammation. So what are some examples of NSAIDs? Ibuprofen, Advil,
Aleve.
Aleve, Motrin. Those are all NSAIDs and they're anti-inflammatories. So those are on one side and Tylenol is on the other. So we'll keep them separate. So what is the classification of Tylenol?
Diuretics.
Antipyretic and non-opiate analgesic.
Analgesic.
Perfect. And that's exactly how you'll say it. So I'll say, okay, what's the other name for, what's the other name for Tylenol? You'll say acetaminophen. And then I'll say, what is the classification? And you'll say antipyretic and I'm sorry, it's not anti-analgesic, it's an analgesic, which means reduction of what?
Pain.
Pain. Exactly. And then now my next question, and this is why it's a little bit more simplistic because there's only 2 more questions to it. What's the max daily dose that you can take of Tylenol? I don't expect anybody to know this. And if you do,
Is it 4 grams?
what the hell? Who said that?
600 milligrams.
No, 4 grams. That's
Yeah.
right. Who said that?
Me, Andre.
How did you know that? Or you don't have to tell me, but that's absolutely correct. Nobody ever knows that for semester. Okay, yeah, excellent. So what is 4 grams in milligrams? How many milligrams? And anyone can
4,000.
4,000. Perfect. So the max daily dose of Tylenol is 4,000. Why might that be important? What part of your body, what organ can Tylenol potentially be toxic to?
Liver.
Exactly. So if I know, if I go, I'm working at Me Memorial and I'm looking in my MAR and I'm about to give medications and my patient is saying I'm having pain and I know that they have a cirrhotic liver. And what is a cirrhotic liver? It's a liver that's not working well, right? It's really either you're on a donor list or basically you wouldn't want to give them Tylenol, right? I think we all would. It would be a red flag. It would jump out, and you could potentially save this person's life, or at least help their liver even more not to continue to fail. When you question this order, if you saw it in their chart,
Yes.
if someone had cirrhosis and they had Tylenol, I would call the whomever, the NP, or doctor, and I would ask her, and you'll notice I go her and him because everybody always says him, and we got to stop that. It's him or her. So I go back and forth. So I would call her and I would ask and say, Mr. Jones in room 3, I noticed that he has Tylenol as a PRN, but he's actually in liver failure. Is this an order that you want me to continue or discontinue? And more than likely it was just a mistake. And then boom, you just saved the patient just by knowing that. So we're going to do it one last time and then we're going to move on to the last part. So Tylenol, what's the other name for it?
Acetaminophen.
Perfect. Is it over the counter?
Yes.
Yes.
What is the classification?
Antipyretic and analgesic.
Perfect. And what is the max daily dose?
4,000
4 grams.
milligrams.
Perfect. And what is the organ?
Liver.
And you guys get what I mean when I say that. I'm just shortening it up because eventually we're gonna have a ton of these, so we'll go through it just that fast. Wasn't that cool? And this is the baby one. So, any questions about that? So this is what I consider a little bit more of the simplistic way. Now we're gonna go just a little bit deeper, and this is the last part of our being online. And I chose this one specifically because even though you haven't really gone through medications, I think most people have heard of Prozac. I'm just gonna ask, does anybody know what the classification of Prozac is?
Is it an anti-anxiety, antidepressant?
Yes, who said that?
Erica.
Excellent, yes. I keep forgetting I'm recording. I gotta be careful what I'm saying. I keep cursing. Okay, so absolutely. So Prozac And I'm not expecting, there's no like test or anything like that. I'm just showing you a method, guys. So please don't stress out. Like if you're like, oh my God, I can't remember all of this. And all of these are gonna stay here. So we're gonna keep going over and over every week. We're gonna add 2 and it's gonna become much faster. I'm just teaching you the method right now. But I don't expect you to remember it. I want you to know the method. Okay, so Prozac. Even though so technically it is an antidepressant. Yes, it can be used also as an anti-anxiety. But we're not going to mention that. We're going to know it, but we're not going to mention it. And you'll know why as we continue down the line, as the weeks go on, why. You'll see why. Okay, so Prozac, what is its classification? It's an depressant, exactly. And there's certain medications that are antidepressants that are specific to certain things. And this one has 4 letters that it's referred to as. Does anyone know what it is? It starts with an S.
SSAI.
So close. I'm going to give it to you anyway.
SSID.
Oh, actually, I think you said it right. Say it again.
SSRI.
So it's an SSRI. And I'm not going to sit here and get deep into it because, again, oh my God, I have dog hair in my throat. Oh, excuse me. Sorry, because I'm trying to turn my computer off. Okay, so exactly. So I'm just, again, teaching you the method. So Prozac, it's an antidepressant. And then it's more specifically, it is in, and then you guys would say SSRI. And I'll tell you what it stands for, but you don't need to remember this, but it's selective serotonin. Maybe remember that part. Serotonin. So it's a selective serotonin reuptake inhibitor. So basically why I like you to know those 4 letters, and we'll go deeper into it later, again, because I'm trying to help you with connections. What is it doing in the brain and how is it working? So that will help you make connections and learn medications easier. You'll just watch. So what neurotransmitter in the brain does Prozac work on then?
Serotonin.
Boom, exactly. Perfect. So what is the classification of Prozac?
Antidepressant.
Beautiful. What could it also be used for? Except to the side, but now.
OCD.
Exactly. OCD.
Anxiety?
Which is an anxiety disorder. Perfect. Now I'm just messing with you. But yeah, you guys both got it right. Beautiful. I think I should just like slide you into the other class and we should just all do this together because you guys are really smart. Okay, so Prozac, antidepressant. And what is it specifically? What are the 4 letters?
Is it
SSRI.
SSRI.
And what neurotransmitter in the brain does it work on?
Serotonin.
And my last question is this. If it's working correctly and doing what it's supposed to do for, which I will eventually teach you, and it's doing what it's supposed to do, because it may not work, right? Medications don't always work for everybody, and we might have to try something else. How should you feel? And I'm gonna answer this because most people will say euphoric. We don't want to say that because you're not supposed to feel high when you take Prozac. This is not a habit-forming medication, and it's not, or potentially habit-forming. I like the word well-being. And I like that word. And you can, when you're talking to your patients, of course, but give different words. It doesn't have to be exactly what I say. But I like that word because it's not giving false reinforcement. Because a lot of people that do suffer with depression, and as you all know, mental health is my thing. I mean, I can do all nursing, but this is my specialty. It's more like, okay, well, yeah, if it's, I want to get out of bed today, or I kind of feel like I might, I'm feeling better. My appetite's coming back, or maybe I don't want to eat as much. It's more about just feeling well-being. So does it make sense why I chose that word? It doesn't mean you're going to jump out of bed and be like, I'm going to run 5 miles a day. Okay, then potentially we're having a problem if that's happening. So Prozac is an anti.
Depressant.
Listen.
Kids specifically.
Yes, I'm sorry.
You're fine. No, you're fine. You just scare me because I'm like, who are you yelling at? I'm sorry. What are the 4 letters?
Antidepressant.
And what are the 4 letters?
SSRI.
And what neurotransmitter does it work on?
Serotonin.
And if it's working correctly, hopefully your patient will feel
Well.
well-being. And how long does it take an antidepressant, this antidepressant and SSRIs in general, that classification, to usually start working?
Is it a month?
4 weeks.
Yep. I usually say 3 to 6 weeks, and 6 weeks is the kind of that peak. So about 3 to 6 weeks. Some people start to feel it in the first week, but again, we want to make this short and simple so that we remember the so yes, I would say 3 to 6 weeks. So perfect. All right.
So Prozac is the brand name.
Mm-hmm.
What's the generic name?
Fluoxetine.
Oh.
Are you gonna ask me to spell that?
No.
I can if I write it down.
No, that's okay.
Oh.
Okay, Madison wants you to know. It's spelled Fluoxetine. Fluoxetine.
Perfect. Thank you.
You're welcome. Okay, so watch how this works, guys. It's amazing. Watch this. What's the other name for Tylenol?
Acetaminophen.
What's the classification of Tylenol?
Antipyretics and
Antipyretic and
Yeah,
anti-analgesic.
antipyretic.
And what is the max daily dose?
4 grams.
4,000 milligrams.
And what organ?
Liver.
Liver.
Beautiful. What is the classification of Prozac?
Antidepressant.
SSRI.
You have to wait till I say specifically. But good job. Specifically.
SSRI.
And which neurotransmitter does it work on in the brain?
Serotonin. Serotonin.
Correctly. Hopefully we will feel what?
Well-being.
And what is the other name for Prozac?
Prozac to be something like
No, oxetine.
Fluoxetine.
I like the accent sounded prettier. Yes, fluoxetine. And I'll teach you more next week, but just for fun, 90% of your serotonin is in your gut. And I'll tell you more about that next week. So next week we'll do 2 more NCLEX questions, and I'll add just 1 more medication, and then we'll do something else. So because obviously we're not just here to do this, but I wanted to show you the method. Do you see how kind of cool that was? I mean,
Right now, I'm almost done.
no, she's not.
Oh my gosh, a stupid mute button.
Never mind. I've seen more. I've told you what I've seen, right? Yeah. So yeah, that's nothing. Just keep your clothes on. That's all I'm saying, because people have made mistakes. Be very careful on Zoom. Okay, I kept you a little longer than I said I was going to. But the work that I gave you is still not going to take you longer than a half an hour. You have till 5 o'clock to do it. One thing I want you guys to know, please, if you miss class and then you go back and watch the video, you have 48 hours to turn in your homework. Now, that's not if you just missed class and you didn't tell me. You have to text me and say, hey, Miss Amanda, or whatever you want to call me. Amanda, hey, I have a dentist appointment. I can't make it to class today. My tooth fell out. You know, let me know what's going on, or let me know, hey, I'm going to be in clinical, but I will watch the video, and then you have 48 hours to turn in your homework. Does that all make sense?
Yes.
So I won't deduct points from you or any. I know it's a pass-fail class, but still, you won't be penalized for that. You just need to let me know, and it can't be obviously I have it every week. Does that sound good? Fair?
Yes.
Any questions before we sign off? And then I'll start downloading it, and it should be up. Usually it takes me anywhere from 6 to 24 hours to have it uploaded.
For the after class assignment, it says please list the steps of the nursing problem. Do you mean process?
Oh Lord Jesus. Yes.
Okay. I was like, I don't think I know what that is.
Nobody answer it yet. Let me fix it really quick. But yes, it's supposed to mean process. It's because I have this stupid keyboard that I have to use. It looks like a typewriter. It's supposed to be for fun, but I have to use it because I can't type, and it's a mess over here. Oh my God. And I usually make typos anyway, so just imagine. Okay. Yes, so please let me fix it real quick. Well, no, you can still do it, but yeah, I'm gonna fix it so that not everyone's confused. Thank you for pointing that out. Any other questions? Did you guys learn something today?
Yes.
Kind of cool, right? I don't know. Maybe I'm just a nerd. I think it's fun. And we'll just keep building. We just keep building the layers, and it's gonna be amazing. Just watch. Your foundation's gonna be thicker and thicker and thicker. I wish it weren't being recorded right now. Otherwise I'd make a joke, but I'm not going to. Okay, there's one chat. Yep, I will stay on for you. So I'm gonna stay on privately and talk to one student, and then, but I need to stop recording. So once we're done, does anyone have questions before I leave? Sorry, I almost just hung up on all of you.
No, thank
Is
you.
there any way you and I can talk as well after the student?
Yeah, you know what? Why don't we do this instead of doing it through this way? The student that did the Zoom chat privately, can you call my cell phone? You don't have to say yes or no. You can just write it in the chat. And then, sorry, I didn't see who said it. And then the next person call me in like 15 minutes.
Okay, perfect. I'll call you in 15 minutes.
Does that work? Okay. And then you know who I'm talking about. Hopefully call me. I'm writing it. Okay. Okay, perfect. Okay, so I'm gonna stop sharing. I'm gonna sign off, and then I'll get this uploaded as soon as I can. And I'll talk to the two students hopefully any second now. All right, good job, guys, today. Very, very good job. Pat on the back, please. Give yourself recognition.
Thank you.
You're most welcome. Thank you for participating. I'll meet you guys I'll see you guys on whatever day it is next week that we meet. Tuesday. All right, thank you.
Bye.
Bye.